second one is what we call the dissecting instruments. Dissecting instruments are divided into two. One is a traumatic dissecting instrument, the other is the atraumatic dissecting instrument. Now, what is the difference between the atraumatic and traumatic instruments? Is that atraumatic instruments basically means that it doesn't cause any tissue damage if you hold it directly, okay? Such as a palpation probe, okay? Unless of course you use force, you can injure the tissue, but basically you can hold it. This is a bowel grasper, okay? This is your Babcock, okay? Now the other instrument is your traumatic instrument. Now the myoma screw, okay? Threaded myoma screw is a traumatic instrument. Okay? This is your Maryland. This is your right angle, okay? You can see that. This is your Kelly. This is your claw, right? And this is your alligator forceps. So these are traumatic instruments. So you have to know where or what type of instruments that you want to use during surgery. Now, usually when we put in blunt instruments like this, okay, is to assess the surrounding area when you put in your first instruments. Alright, so palpation probe are the usual instruments that you use when you go in, just to assess the surrounding condition of your surgical field. Okay? The traumatic instruments are quite specific to a specific function. Now, if you want to peel off a cyst wall, probably you would use a pointed end Maryland. And if you need a different angle, so probably you use a right angle, okay, to help you to peel off the cyst wall. Okay, so these are specific function. Okay, now if you want to hold a tissue harder, okay, or stronger, okay, you can use a claw forceps. Alright, so claw forceps can be used to achieve the objective of holding a tissue stronger. Sometimes the dissection needs a lot more holding power, so you can use that. Now, I just want to share with you that reusable instruments consist of three parts. Okay, they have the tube, okay, they have the handle, and they have the insert. Okay, so you can actually buy all these instruments separately. Okay, so most of the time the handle is the most durable part of the instruments, and insert and the tube are the usually parts that you need to change. Now, if the patient can afford, okay, it is better to use disposable instruments, because in instruments like this, it is quite, I would say, not possible to always clean thoroughly. Okay, you have been using this reusable instrument because of there's limited monetary funds to buy all this stuff, right? But if you have the money or the patient are willing to pay, okay, it is good to get a disposable instrument.